nationally, I am part of the resident advisory group. We give our feedback on the SCORE questions, which are questions we use to study for our national boards and for our annual exams. It's also a group that dedicates itself to surgical education nationally. At the university, I was a class representative. You pretty much ask to be one, and if you're voted, elected, you can. You represent your class, obviously, in making the schedules and if there are any issues or new programs you want to develop.
I'm also involved in the Leaders program, which is a program through the college, actually, where they pair attendings and residents with college students who are coming from an underserved background, so mostly people who are part of minority groups that are underrepresented in medicine. And so I've been paired with a young college student who's hopefully going to be matriculating to medical school last year, helping her with developing professional skills, resumes, getting exposure, shadowing, things like that.
We are also involved. Banner has a big leadership in Surgeons as Physician Leaders program that I plan to get involved with this year, which is a cool leadership training program as well.
Another opportunity here worth mentioning is this Spanish diversity course that a few of the surgery residents are in. So we meet monthly. It's an hour and a half long education session where pretty much we learn how to speak Spanish. So it's a 2-year program, and by the end of it you can take that test where you officially become a bilingual physician and can really talk to patients.
My profile outside of Stanford has historically been one of a researcher and a translational researcher and innovator. And I guess, although I'm a very busy clinician, I'd like to just make the trainees aware that this is something that we are going to build into the DNA of the University of Arizona going forward. We want it to be the place where new innovations and new cures are invented, and that if that is something that a trainee wants, I think we are well positioned to give them the best possible experience.
One of the things I think we take pride in is our ability to not only do research but mentor our residents and students through research. We also have a research mentorship program for certain areas. We try to identify early on in residents' careers what path they wish to pursue and have dedicated sessions on the things that they need to do to get into those professions.
So I think there's 2 parts of it. One is what your level of interest is, and the other part is trying to figure out the questions that you want to answer. This is an academic center. It's something that we are incredibly proud of. The whole idea is that we don't want to force things on people. If you want to spend time doing research, we have avenues for you to do formal research years. And for people who say, that's not my biggest interest, there are other things that I want to focus on, then we can have those come together.
When I first came here, I was really interested in doing research, and one thing I asked all the programs was what are your research opportunities, and how easy is it to get them, and what's the process like? And what I found is that our program is actually really supportive research.
As a program, they really put it in your hands how much or how little research you want to do, and there's a large wealth of opportunities, a lot of attendings that are very involved in research and are very supportive in helping you.
The trauma department's really big on research. The surgical oncology department, the hepatobiliary service, all of those are pretty big on research, and there's tons of opportunities for it.
We're pretty flexible with, if you want to do research, you can, and there's that opportunity there. But you don't have to if you don't want to, if that's not the kind of path that you want to take. So that was a big draw, especially as I was entering residency, because I'm still not sure what I want to do. So kind of having that opportunity to have a huge variety of different rotations and getting exposure to many different things was very important to me, and I valued that a lot.
2 of our recently graduated residents, were out for research for 2 and 3 years respectively, and then when they came back, they were, no space was made for them. No one was told to, oh wait, no, you can't come back this year because of A, B, and C. No, I think the program worked really well in being able to have them rejoin the program and graduate, when they wanted to.
I did 2 years of research fellowship when I came in, and I still have research is very, very easy, accessible in this university. We have multiple national databases. I just can have an idea, discuss it with an attending, and just go for it. And the data is available, and there's lots of supportive mentors around you.
Before I even went to med school, I was doing research, and I did it all through med school. And then when I got down here to U of A, I wanted to continue research, obviously. I love research. I have that bug. Some people do, some people don't. And so I'm actually working with a surgical oncologist, hepatobiliary specialist, and we've done a few projects actually.
You know, I went to med school here, and so I started doing research in I think my 3rd or 4th year here with the surgical oncology service with Dr. Fonsum. So I got involved with research pretty early on. So I've done a few projects with that, and we have had a few publications. And now I am working with actually one of our endocrine surgeons to study, you know, minorities in healthcare administration. So that's something that we're currently working on.
Another exciting aspect of the research being done here at the University of Arizona, Banner University Medical Center, really is the patient populations we're able to study. We're very uniquely situated to look at certain patient populations and demographics. Our reach goes way beyond Tucson as our ability to treat patients.